Hello, my name is Robert Newmar, and I'm the immediate past chair of the Emergency Cardiovascular Care Committee of the American Heart Association.
I'm Graham Nickel. I'm a professor of medicine at the University of Washington Harborview Center for Pre-Hospital Emergency Care.
And we're here at American Heart Association Scientific Sessions to talk about late-breaking science. And Dr. Nickel is with us to talk about the study that he's going to present.
We presented a large randomized trial in patients with out-of-hospital cardiac arrest. We were aware that in animals, when compressions are stopped, blood flow immediately reduces and appears to reduce the likelihood that the animals could be resuscitated. And in humans, it appears in observational studies that continuous compressions increases the likelihood of survival. So in a large research network supported by the National Institutes of Health and the Heart Association, we randomized patients without a hospital cardiac arrest to receive continuous compressions with positive pressure ventilation by EMS providers, or compressions interrupted for ventilations with bag mask. So both groups received compressions. In the first group, they had compressions without interruptions for ventilations, but they still received ventilations. And in the second group, they received compressions with interruptions for ventilations.
And what were the results of your study?
In the 23,000 patients who had out-of-hospital cardiac arrest and were treated by EMS providers, we found that survival was not significantly worse in the group that received continuous compressions with ventilations compared to continuous compressions with pauses for ventilations. We found that neurologic outcome was not significantly worse in the group that received continuous compressions compared to interrupted compressions. But the patients who received compressions with pauses for ventilation were more likely to be admitted to hospital and were more likely to have days alive and out of hospital during the first month after cardiac arrest. So both groups did well, but it appears as though the group that received compressions with pauses for ventilations did a bit better.
Very interesting. And the recent American Heart Association guidelines that were published in October suggest that our current recommendation is that for patients that are getting bag valve mask ventilation, that compressions should be paused every 30 compressions for 2 ventilations, but after an advanced airway is placed, such as an endotracheal tube, the recommendation is for continuous chest compressions with 10 ventilations per minute. So how does this study inform those guidelines?
Well, that's a great question. In both groups, after the study intervention had completed, which was about 6 minutes, the paramedics inserted an advanced airway and gave continuous compressions at 100 a minute with ventilations at 10 per minute. So I think we really tested the recommendations from the guidelines and reinforced that when patients are treated by firefighters or EMS providers, they should continue to receive pauses for ventilations.
Excellent. Any other information or insights you want to share about the study?
No, I think we've collected a lot of data. I think that we're continuing to analyze it so we can better understand it, but I think that this large randomized trial, and this was the largest randomized trial that has ever been conducted for patients with out-of-hospital cardiac arrest. I think this large randomized trial reinforces the Heart Association's recommendations.
Well, I just want to congratulate you and the work of the ROC investigators for your ongoing research in support of the mission of American Heart Association, and we're excited to have that work presented here at the American Heart Association sessions.
Thank you very much.